Many of us know or will know someone with cancer.
And for women, there are certain types of cancer that we all should know more about.
We've invited Dr. Leigh Seamon of the Spectrum Health Medical Group to join us today.
She has a very specialized area of gynecologic oncology, and today she's hosting an online chat about the most common gynecologic cancer, endometrial or uterine cancer. It's kind of a big mouthful, but it's specifically, these are cancers that will only impact women because of our biology, right?
Exactly. All women are at risk for GYN cancers. GYN cancers are essentially uncontrolled growth and spread of abnormal cells within the female reproductive system. These include the cervix, the uterus, the ovaries, the fallopian tubes, the vagina, and the vulva.
Okay, so women biology that have to do with reproduction.
Correct.
So which women are most at risk?
You know, that's a good question because all women are at risk, particularly if you have a family history of breast or ovarian cancer, or if you have Lynch syndrome in your family. Those women are most at risk.
You know, it's interesting, Dr. Seamon, as we kind of think about it, it really becomes such an emotional issue because you think about someone, especially a young woman who may be diagnosed with this, who hasn't completed her childbearing or her wish to have a family. I'm guessing that in your office, boy, there have got to be a lot of heartbreaking stories, not just involving your ability to survive cancer, but your ability to preserve your ability to have kids.
Yeah, and you know, there are great techniques nowadays to actually do fertility sparing operations. And so in a lot of cases, women can retain their uterus and their ovaries. Of course, in some cases they cannot. And we don't want to compromise the cancer diagnosis, obviously. We want the patient to have the best cure. But we do have technologies today where we can hopefully preserve the ovaries or the uterus if the woman is still childbearing and wants to have children.
And so what are those kinds of diagnostic tools that you use to help you figure out and diagnose basically a woman who may have cancer?
So there are a variety of things. The most preventable cancer is cervical cancer, and a pap smear test is very important. All women should be talking to their doctors about this and following the current guidelines from their provider on getting pap smears. Pap smears have decreased the risk of cervical cancer by 74% over the last 50 years.
It's incredible, really, that one test, what it has done.
Absolutely. The other thing that all women need to know is that there's a cervical cancer vaccine. And this primarily affects young women. Ideally, they would receive the vaccine, it's 3 different shots, before they have their sexual debut. So pediatricians and gynecologists are recommending that between 11 and 12. But it's approved for 9 to 26-year-old women, and it's also now approved for men.
Okay, a little controversial.
Very controversial.
A lot controversial when you talk about immunizing your kids and protecting them against a future sexually transmitted disease.
Yes, it is such a prevalent disease. It's caused by HPV, or human papillomavirus, but it's very prevalent in the population. And it's amazing that we have a vaccine that actually can prevent cancer. And I think if you are a young mom and you're wondering whether or not to vaccinate your child, the answer is without a doubt, definitely yes.
Fantastic.
Are there specific symptoms that a woman may encounter?
Yes, so for cervical cancer in particular, beyond the pap smear test, then there's early detection. If you experience pain with intercourse or you're having bleeding after intercourse, that's one of the first early symptoms of cervical cancer. Of course, it could be other things, but you need to alert your doctor. The other thing is postmenopausal bleeding. If you have any bleeding after your period, you stopped your periods and you're now in the menopausal age, if you have any bleeding after that, you should see your doctor right away because an endometrial biopsy can be done that could potentially detect endometrial cancer. And most endometrial cancers, if detected, are detected early and can be cured. So that's very important. Postmenopausal bleeding, a lot of women, you know, they go through the change and they say, you know, I had a little spotting, and they just kind of ignore it. And I hear that story over and over again. For ovarian cancer, that's a little bit of a game changer. It's known as the silent disease, but it does have symptoms, mainly bloating, eating, getting full really fast, The other symptom is urinary frequency and urgency. These symptoms are all symptoms that women sometimes have and they go away, but if you have daily symptoms for more than a few weeks in a row, you should alert your doctor.
You know, and it is about having that great relationship with your doctor so you feel comfortable asking those questions and giving a call to the office if you notice something that is out of the ordinary. You actually have a special online chat that you'll be participating in so people can go to their computers and actually talk to you about their questions. Tell us about that.
Yes, so this is a great opportunity. Today from noon to 1, I'm going to be live online. We'll be posting, you can post your questions, and we'll be posting polls and showing those as well. And so anything that you want to ask, mainly it's about endometrial cancer today, so we're trying to limit the topic. You might know someone who's diagnosed with endometrial cancer. You might wonder if you're at risk for endometrial cancer. So I'll just be there online for an hour to answer all of your questions.
You know, we really like our partnership with the Spectrum Health Medical Group because so many of the doctors have such great expertise and people have a lot of questions. And boy, if you want to know more about any of those topics, these online chats are just fantastic. Dr. Seamon, thank you so much for being here with us today.
It's been a
We'll
pleasure.
get that information available on our website. You can join in. You don't have to be a patient of Spectrum Health Medical Group to participate in this online chat. It's free and open to the public.
Yep.
We'll be right back.
Thank you.
This is 8 West.